Welcome to the first ever virtual BabyBoom. BabyBoom is the premier destination for a new generation of parenting where organizations and brands have a chance to connect face-to-face with influencers and press. My name is Bethany Braun-Silva and I'm the editor of parenting.com, a one-stop shop for parents and caregivers to learn, research, and discover products related to their parenting journey. And I have the unique opportunity to be sitting in the brand new New-York-Presbyterian Alexandra Cohen Hospital for Women and Newborns. I'm joined today with a team of healthcare experts who have come together to talk about the launch of this incredible new state-of-the-art facility that has just opened its doors this week. Together, we will also be diving into the importance of fourth trimester care, as well as the importance of better supporting new moms. On the panel this morning, we have Dr. Malavika Prabhu, who's the Associate Director of Labor and Delivery, Dr. Aja McDougall, who's the Director of the Women's Health Clinic, Carolyn Migliori, Registered Nurse and Lactation Consultant, and Maria Chandris, Nurse Administrator for Weill Cornell OBGYN Faculty Practice. I would love to go down the line here and just get each and every one of your thoughts on the importance of fourth trimester care and sort of what inspires you about this new hospital. Dr. Prabhu, we'll start with you.
Sure. So, traditionally the postpartum time period has really been focused on physical healing. We see patients after they have their baby. We make sure that they're doing okay in the hospital. And then our next touch point is around 6 weeks postpartum, at which point any complications they may have had, pain they may have experienced, difficulties feeding the baby, some of that may have receded into the background, and then we see them at 6 weeks and think, oh, things are going really well. But what we've realized here at this institution and therefore prioritize is that there's so much happening between delivering the baby and 6 weeks postpartum. First, both pregnancy and the immediate postpartum time period really are a window to future health. And some of the things that we learn about patients' health are really an opportunity to counsel them on risks they may experience in their later life when they're no longer seeing an OBGYN and needing to see a PCP. We also really think that postpartum depression, as we've talked about earlier on this panel, is really important. And thus we implemented the 2-week televisit just to make sure that patients are doing okay and coping well with their baby. And then I think the most important thing is really being able to give women the lactation support that they need, both in the hospital and once they leave. And all of those things really have helped us to put the postpartum period on the forefront of care at all patients at this institution.
What I'm so passionate about is the initiative, the drive, the goal of healthcare equity. And this postpartum period identifies that, look, we all have our differences, but the one thing that's the same is that when you have a baby, you need help. And you need the people who are dedicated, who care, and you need access to healthcare. As Dr. Prabhu mentioned, many patients, whether it's difficulty in getting access or just maybe education and not knowing and recognizing the importance of going to that follow-up postpartum visit, they just don't make it there. And we know that there's a small percentage of women, less than 30% sometimes in our women's health practice or also the clinic, who just don't show up to their postpartum visit. So this is an opportunity with the fourth trimester telemedicine program with our new hospital to make sure that we increase our healthcare equity initiatives.
And Carolyn, to you, same question.
So the fourth trimester, the moms are recuperating from their delivery, they're focusing on their new baby, and the sometimes issues with breastfeeding are there, and we all know that breastfeeding is best feeding for this new baby. So we're there to support this mom, following up with her after discharge, so that ideally these moms will be able to continue breastfeeding for what's recommended by the American Academy of Pediatrics for a minimum of 6 months and ideally a year. And they have access to us even by telephone calls past the initial postpartum period. So they're able to call in, have a face-to-face over Zoom with us at this point. and that's going to continue. And with our resources here now in the Alexandra Cohen Hospital, we'll be able to provide that for all patients.
Postpartum, for me personally, I have to say, this has been a great project for me. I have a passion for this. I think that the postpartum period is probably the least talked about and very important. I can't say most important, but I think it is very important. It's a time where patients have a lot of questions, and they're, especially new moms, they're very, very anxious. And during these video visits myself, they, as I said earlier, they have so many questions and such apprehension, and they just need reassurance and guidance and support. And I think it's so important for us as nurses to just be there for these patients. And I don't care who the patient is. Whether or not she's a mother of 3 or she's a new mom, each pregnancy is different. Each delivery is different. And so the questions are different. And it's just important, and I enjoy it. And I think that our goal as nurses is to provide support and unbiased, I always say this, unbiased, non-judgmental, and unbiased support. And I love when they call back and they ask to speak to us, and they want to do more video visits. And I know that we're there for our patients. So it's been very rewarding for me personally, and I know that we're there for our patients, and that's what we're here for, right? So it's been great.
Great, thank you. What are some of the ways this new hospital is improving care for women?
I'm so excited to talk about all of the ways New York-Presbyterian Alexandra Cohen Hospital for Women and Newborns is improving care. What I'm most excited about is that this hospital really focuses on family-centered care from the entire course of the patient's delivery, her labor, her delivery, and her postpartum care. We have multiple single rooms for patients. There's privacy for patients for their entire stay. Families and partners are able to stay both with the mother as well as the newborn. And even in the case that the newborn needs to go to the neonatal ICU, there are single rooms there as well for families to spend with their infants as they grow from their prematurity. In addition, we have put together multi-specialty complex teams to take care of high-risk women, as well as have lots of interventions and care set up to take care of low-risk women, and are able to take care of a capacity of up to 7,000 deliveries a year, really to care for lots of women excited to meet their babies.
Thank you. And Dr. McDougall, just to piggyback off of that a little bit, how do the changes that Dr. Prabhu has been talking about, how does that affect the care for women?
Absolutely. Dr. Prabhu and I work very closely to implement best practices for all women, not only in their postpartum care, but also before they deliver the baby. So one of the populations of patients that I work with are patients who are underserved, are patients who come from different areas in New York City, including the outer boroughs, who come specifically to New York-Presbyterian for the #1 care in the New York City area. And in the postpartum period, what is so important is ensuring that we include all women to include access for care. And that is one of the top priorities for New York-Presbyterian, as well as the Weill Cornell OBGYN department. So we're very proud of the work that we've been doing to increase access to care for all women in New York City.
And Dr. McDougall, can you talk about the current and versus proposed care at the New York-Presbyterian Alexandra Cohen Hospital for Women and Newborns in regards to postpartum depression?
Absolutely. You know, one thing we know, as Dr. Prabhu mentioned, is that the postpartum period is a period of transition, both physically, emotionally, and we know that women need to have their voices heard, especially in regard to mental health and depression symptoms. One of the things to keep in mind is that of all the things that can happen to you, we know that depression can happen more often than any other complications in pregnancy. It can happen before you deliver the baby, shortly after, and even months after. So one of the things that the 2-week telemedicine implementation has been one of the key points of is to identify women, to talk to them, and to provide support emotionally as well as mentally for postpartum depression. Because we want to hear from these women and be able to get them the proper care that they need.
And now, Carolyn, to you, in the same regard, what is the current versus proposed care for breastfeeding? I know I struggled with it as a mom whose son was in the NICU for 10 days. He wouldn't latch. I ended up having to pump exclusively. So I think a lot of women have that, it could come as a surprise, but it might be also something that they're thinking about prior.
So we have a staff of 13 lactation consultants. Currently, we see every breastfeeding mom after she delivers, and our proposed change of practice is bringing back prenatal breastfeeding classes, and I'm happy to say that as of September 12th, we will be instituting prenatal breastfeeding classes for expectant mothers. We will continue to see every mom while she is here at the hospital. And we have an inpatient breastfeeding class over Zoom for every mom to have access to at 1 o'clock every day while we're here.
Maria, can you talk a little bit about the telehealth services for women and how they may benefit from that right in the beginning of their postpartum journey?
The response to the 2-week telehealth, we call them video visits, has been absolutely a huge success. The patients absolutely love having the face-to-face interaction with the nurses from the comfort of their home. Who wouldn't love speaking to a nurse while breastfeeding in their living room and asking all those questions that they want to ask without leaving their home? So it's been a huge success, and actually our nurses love it as well. We get to ask the questions and see the patient's reaction, and oftentimes our, we, as Dr. Prabhu and Dr. McDougall said, there's a very touchy-goey time for patients, and it's just a question can spark either a tear or a smile, or you get that reaction from a patient that you might not necessarily get over the phone. So the one-on-one interaction face-to-face has been a huge success, and I think patients sometimes don't want to hang up. It's a 15-minute conversation that can be a half an hour or 45 minutes, so it's been a huge success. And we, the nurses enjoy it, the patients enjoy it, and our goal is to provide individualized care and also to provide peace of mind to our patients. And I can honestly say I personally enjoy doing it, and our patients do appreciate our care. So it's been a great success.
I can imagine it is. And Carolyn, just to actually pivot back to breastfeeding for a second, like I mentioned, there was a lot of anxiety around my breastfeeding journey, and I think there's a lot of anxiety. It can be a lot of anxiety around it in general. What is your advice for moms who might be struggling with breastfeeding, and how common is it for women to struggle with breastfeeding?
More common than most would think. I'd say a lot of moms have a lot of anxiety about breastfeeding. They may have heard some stories from friends who had difficulties. And education is probably the one thing that's going to be the greatest for these moms to get before they come in. And then once they've delivered and on the postpartum units, with the help of the entire lactation team at their bedside, and for the class that we offer them every day at 1 o'clock. Patients also get follow-up discharge calls from the lactation team, generally within 2 days of leaving the hospital. Their anxiety level is very high right afterwards, and I like to tell a new mom that your baby can sense that anxiety, so kind of take a deep breath, relax, and let's do this together. That'll help. Lots of questions come up about whether they have enough milk for their baby. The topic of not having milk right away is a little disturbing to some parents. Well, how do I know if my baby is getting enough? So education is the key point to all of this, and that's our goal as the lactation team here at the hospital.
And Maria, going back to the fourth trimester, do you have 2 or 3 pieces of advice for moms to really take care of themselves during that time, or even questions or issues they can address with their own healthcare provider in the 4th trimester?
I have a lot of advice. I think that, first of all, I think that our society does a wonderful job taking care of pregnant women. I think that we offer a seat to pregnant women. We encourage them to eat enough, to drink enough, to rest their tired bodies and to elevate their feet. I think when the baby comes, our friends and family concentrate on the baby. And then I think as new moms, we tend to know that we're going to care for our babies, and we know that we're going to feed our babies and hold our babies and love our babies, but we don't always think about how we're going to care for ourselves. We know we're going to care for ourselves, but we don't always realize how we should care for ourselves or how much we should care for ourselves. So my advice would be to just take the time to care for ourselves, or me time, obviously get the rest that you need. You need me time, as I always tell our patients. There should be obviously you need to rest so that your body heals. So physically, you need physical well-being. You need mental health well-being, right? So there should be some time for self-reflection. You should definitely delegate housework. Whatever it takes, if it's a mani-pedicure or a yoga class, just take some time for yourselves. I think that's the most important. So when we do these 2-week telehealth visits, we go through a bunch of questions, and mental health and physical health is key, but it's all about me time is important.
And if I may ask a follow-up question, what would you tell to partners of pregnant women how they can help support their partner during the 4th trimester?
Partners?
Yeah, like spouses.
Again, I would say, that's a very good question. And I think that the most important thing, what I enjoy about the 2-week telehealth, the video visits, is that patients, we as nurses, we enjoy it because we are unbiased and we don't judge. So we tell our patients that they can tell anything that they want to us because we're not partners. And so they can just tell us whatever they want to tell us, and we will not judge them. So for partners, that's a little bit more difficult. So partners have to not be judgmental, and they can't be biased. So they can just only support their partners to the best of their ability and support them and provide, go ahead, I'll take care of the baby, and go get your manicure, pedicure.
Thank you.
Does anyone else have anything to add to that?
Or maybe what you wish your partner would have done right after giving birth? I don't know.
I'll often ask a partner when I'm in the room with a patient, do you cook? And they'll say yes. I'm like, good. Do you do laundry? Yes, I always do. Good. Can you clean a bathroom? You're hired. So, because they need to know that mommy's responsibility when she goes home is to feed herself, rest, and feed her baby. Those are her jobs, and everything else goes on the back burner for that new mom.
One of our questions is, do you have help at home? And so depending on how patients ask that, it's helpful to us. And then we can go run with it, or we can say, you need to get some help. And that's a key to how we can evaluate or assess the patient's mental health or well-being. So it's huge.
Dr. McDougall, a lot of the changes that were mentioned here are part of New York-Presbyterian's larger mission to combat maternal morbidity and mortality. Can you tell us a little bit more about that?
Absolutely, and I think we can't talk about a new hospital and women's health without recognizing our society as a whole. And as we mentioned before, access to care is key in any new implementation, a new program. What I'm so proud of our telemedicine program is that we have extended it to our underserved population and implemented it in a very rapid and have continued it. So telemedicine is here to stay, and it's here to stay for all of our women's health patients, both OB and GYN, and it can be a keystone area to lead to better health throughout our society. So as Dr. Prabhu mentioned earlier, we're identifying health risk early in pregnancy, in the immediate postpartum area, and leading patients to get better care in the future. So that's one of the things, is increasing access to care through telemedicine.
And I think that might go hand in hand with receiving care for postpartum depression. I know there's varying degrees of PPD, and sometimes it goes away on its own, sometimes it could be a bit more serious. But when should a mother ask for help from her healthcare professional?
That's a great question. And as Maria mentioned earlier, self-care is the number one care that all women should have, not only during pregnancy, but immediately after. Our society is great. I'm so glad you mentioned that, Maria, in taking care of pregnant women. But I think afterwards, we do need to do more work, and the same work that we're doing here at New York-Presbyterian is focusing on that fourth trimester. Women, we know that you can experience depression before and immediately after, but the time is now to speak up about it. Voice your opinion. Often the voices of women who suffer from depression are not heard, and it's painful as physicians to find out that patients have suffered when we could have provided them the help that they needed. Call your provider. Get in if you can't get to the hospital, get to the office. Have a telemedicine visit. If you have a device, you can have a conference with your provider and get access to care. All treatment for depression does not include medicine. Sometimes it starts with a conversation, and then you can get the help that you need based on what you need. But we definitely have to take care of ourselves as women and make sure that we're voicing our concerns about depression.
So do you have any words of advice for women who are currently in the trenches of postpartum depression? I know it can be confusing and it can be scary, and I know they would really love to hear what you have to say.
Absolutely. And the one thing I would say to women who are experiencing depression is that you are not alone. Many women experience some form of depression, anxiety, mental health issues, and you may not even realize it. But if you know you're not at your best, call someone, call your provider, call them today, and take that time to get the access to care that you need. I think we really summed it up quite clearly about what our initiatives here are, and that we need to do as much as we can for women in the postpartum period, but specifically for depression, because it just goes, unseen, unheard, and unaddressed. So call, you're not alone, make sure you get the help that you need.
And final question, Dr. Prabhu, what are you doing to combat the stigma around postpartum depression? Just like Dr. McDougall said, women can suffer in silence. It can certainly be scary, and it's not really talked about as much as I think everyone here would like it to be. So what are you guys doing?
That's a great question. And the first part to realize is that the first time the conversation about postpartum depression comes up should not actually be in the postpartum period. And here in our practices, we screen for all patients to see whether or not they may have depression actually in pregnancy, as one of the panelists first mentioned. And if they do, we can get them help to resources even sooner. But even if they don't, it's really a great opportunity for us to start to talk about postpartum depression, what it is, what are typical symptoms, what to look out for. And then this is a topic that is discussed again during the patient's postpartum hospitalization by their provider prior to discharge, typical warning signs. I think one of the most important things to think about and to tell the patient, which is something that we do, is that this is something we talk about with everyone. We bring this up. We think this is the most important thing to talk about because actually it is the #1 postpartum complication that patients experience, more than blood clots, more than high blood pressure, more than other medical complications. So talking about it with everyone is the #1 thing we can do to take away that stigma associated with it.
I just wanted to thank all of our panelists for joining us this morning. It has been incredibly informative. I've learned so much, and I'm certainly hoping that all you pregnant women out there have learned something too. For more information, head over to nyp.org/Alexandra Cohen, and here's to a happy and healthy pregnancy and 4th trimester.